much, Mr. Chairman. Mr. Chairman, first of all, I want to thank you for holding this hearing. This panel, in my estimation, make up one of the most diverse panels that I've witnessed since I've been a member of this committee. And I want to thank you again, Mr. Chairman. I would like to thank each and every one of you for taking the time to share your stories and your expertise with us. Mr. Chairman, in my home state of Georgia, we face a crisis, and I would like to enter into the record a news article about why Georgia ranked last in the nation on this matter.
So ordered.
I would also like to express my gratitude for Ms. Fire Reed from Atlanta, Georgia. She shared her story with me about the reality of postpartum depression and the challenges of trying to access health service as a woman of color. Dr. Harris, thank you for being here. I'm so glad we have a doctor from Atlanta, Georgia. We need more like you. You're well aware of the crisis in Georgia. It is worse in our state than any other. We're far behind. We need to do better. We need to catch up. What should the Congress do to encourage better maternal care for women of color? What should we do?
Thank you for your words. And Congressman Lewis, I think there are many things that Congress can do. I would say at a basic level, it's funding and infrastructure. Congressman Brady talked about a national roadmap. Congress and at the national level can develop funding, again, for an infrastructure from which local and community-based solutions can arise. Again, earlier we talked about supporting the MAMA Act. We talked about making sure that there is funding. Several panelists have mentioned the importance of maternal mortality review committees. In order to develop solutions, we need to first identify the problems. And we can't always identify those problems without the accurate data. So funding to make sure that these review committees are adequately operationalized will be key. The other issue, and you mentioned depression, and as a psychiatrist, I think I would be remiss if I didn't mention the fact that we see women suffering increased levels of postpartum depression, and we see that at even higher rates in African American women. And unfortunately, the infrastructure for mental health and for substance use disorders has been woefully underfunded for several years. So funding a basic infrastructure for treatment for mental illnesses, for postpartum depression will be key as well. So those are just a few suggestions.
Ms. Flexley, thank you for your courage. Thank you for being here today. I know you're a great athlete, can run very fast. Why would you want to come in and tell your story and be so personal? Why?
Well, thank you so much. It was very important for me to be here. For a living, I get to do what I'm passionate about, and that brings me much joy. But to me, there is no more important issue than what we're talking about today. You know, I consider having my daughter my greatest achievement, and it was such an eye-opening experience what I went through. I was not aware. I was completely not educated on this topic, and so I am, you know, I wasn't happy to go through what I went through, but I am thankful that I was able to come out and learn so much, because now I feel like with the platform that I do have, I can use my voice to try to have an impact. So I am extremely happy to be here and to share my story today.
Well, thank you for being here. You're back, Mr. Chairman.
Thank you, Mr. Lewis. Let me recognize the gentleman from Nebraska, Mr. Smith, to inquire.
Thank you, Mr. Chairman. And